The APHA-ASP National Patient Counseling Competition. The major objective of the APHA-ASP National Patient Counseling Competition is to encourage student pharmacists in their efforts toward becoming better patient educators. The competition is designed to reflect the changes occurring in pharmacy practice, to promote and encourage further professional development of the student pharmacist, and to reinforce the role of the pharmacist in improving medication use and advancing patient care. The competition begins on the local level as students compete to be the national representative from their school or college of pharmacy. The competition on the local level may be funded from a variety of sources, such as official college funds, locally obtained funding, state association support, and student fundraising activities. Both the locally awarded prizes and the travel expenses for the winner to compete in the national competition will be the responsibility of the school or college of pharmacy. Once the local winner from each school or college of pharmacy is decided, this individual will schedule an appointment to compete on the national level at the APHA 2022 Annual Meeting and Exposition in San Antonio, Texas. The national competition is divided into the preliminary round and final round. During the preliminary round, students select a practice scenario at random and are required to counsel a patient on the appropriate use of the drug involved. Students are then given time to refer to the reference sources available in the model pharmacy. After consulting the references and determining the appropriate information for the patient, the participants counsel the patient. Evaluations are based on the content and style of the counseling presentations. The 10 highest scoring participants are then invited to the final round. The final round involves a more complex counseling situation where the participants again select a prescription at random and are asked to counsel the patient on safe and effective drug use. In addition, the patient in the final round will display personality characteristics such as anxiousness, belligerence, or apathy to challenge the participant's ability to convey pertinent information in a realistic situation. The top 10 finalists in the national competition will be recognized during the APHA-ASP Award celebration and will receive a cash prize compliments of APHA-ASP. For more information, contact the APHA Student Development Department, 2215 Constitution Avenue, Northwest Washington, D.C. 20037. Telephone 1-800-237-2742, extension 7514. Following is the counseling session of the winners of the 2021 and 2020 competition.
Hi, I just picked up my prescription.
All right. Well, my name is Maddie and I'm the pharmacist here and I can help you out with that. Are you picking up for you or for somebody else?
For myself.
For yourself. What is your first and your last name?
Elias Thompson.
All right. And what is your date of birth?
2/14/84.
Perfect. It's nice to meet you, Elias. I did receive a prescription from your doctor, Dr. Andrews, and just because this is a new prescription, I want to spend about 5 minutes of your time going through it with you just to make sure that you can get the most benefit out of it. How does that sound to you?
That's fine. Thank you.
Perfect. So before we get started, I just want to go through my pharmacy profile to make sure that the information I have is correct and up to date. So what allergies do you currently have?
None.
None. All right. I know you're picking up a prescription today, but what other prescription medications are you currently taking?
Nothing.
All right. And what over-the-counter products, supplements, or vitamins are you currently taking?
None.
Okay, perfect. What questions or concerns do you have for me before I start talking about this new medication?
I don't think I have any right now.
Okay, sounds good. You can always feel free to interrupt me if you do have a question. I'm more than happy to answer it for you.
Sure.
So today you're picking up a prescription for venlafaxine extended release 75 milligram capsules. And this is also commonly called Effexor. That's the brand name if you're more familiar with that. And you're going to get 30 capsules in this prescription and you will have one refill remaining. What did Dr. Andrews tell you this medication was for?
So me and Dr. Andrews talked about just like the past couple months and how it's been really rough. Yeah, I mean, quarantine and lockdown has been rough for everyone, some more so than others. And I feel like I'm more on the more rough side.
Okay.
We talked about just, I, recently lost my job and like a month or so ago, like I lost my best friend to an overdose. And that kind of probably hit me the hardest over everything. And after talking with Dr. Andrews, we concluded that I don't want to get to a point where I do something that I don't want to do. And so we concluded that the medication is probably like the best thing for me right now before something like that happens. So.
I'm sorry to hear that all happened to you. And I think you and Dr. Andrews came to a good conclusion. This medication, it is used to help improve mood, improve energy, and it just helps to kind of balancing those brain chemicals to make us feel a little bit better. How did Dr. Andrews tell you to take this medication?
Just to take it in the morning.
Yep, you could take one capsule once a day in the morning and try to take it around the same time every day. And because this is an extended release product, I want you to make sure that you swallow it whole. You don't crush or chew it at all. I also want you to make sure that you're storing it in a cool and dry place out of the reach of any children or pets. And I know it can be very easy to miss medications. And if you do forget to take it one day, I want you to take it as soon as you remember. But if it's close to the time you normally take it, just skip that dose and keep up with your normal schedule. I don't want you to take two in a day or too close to each other. What did Dr. Andrews tell you to expect with this medication?
That's just going to help with my overall depression and to meet back with him in about a month or so.
Yeah, that's exactly right. We're hopeful that this will help improve your mood, but I do want to let you know it sometimes can take a little bit of time before you start feeling the real benefit. So it may take around 4 to 6 weeks for you to start seeing the real benefit of the medication. So it's very important that you do continue to take it every day, even if you don't see a benefit right away. This medication can also cause a few side effects I just want you to be aware of. It can sometimes cause sweating, some weight loss, loss of appetite, dizziness or shakiness, and those usually slightly resolve as you continue to take the medication. And one side effect I do want you to be aware of is suicidal thought or ideation. I don't say this to make you, this isn't common. I just want you to be aware. So if you do have any changes in your thoughts or your mood, I want you to call 911 or call Dr. Andrews as soon as possible. What questions or concerns do you have for me?
I don't think I have any.
Okay, well, I know we went through a lot of information today, but just to make sure that I said everything correctly and appropriately, how are you going to start taking this venlafaxine?
Take it in the morning, swallowing it whole, and making sure it's spaced appropriately. Like, don't double up on a dosage.
Yeah. That's all exactly right. Just to summarize, we also went through some side effects, storing it in a cool, dry place. I want to thank you so much for taking the time to talk with me today. I'm really sorry that you've been having such a hard time, and I'm really hopeful that this medication will help you out. I look forward to seeing you in a month when you come to refill it, and I hope you're feeling better at that time. But thank you so much for your time today. I really appreciate it.
Thank you. Appreciate it.
Hey, so I'm here to pick up a prescription.
Hi there, my name is Henry. I'll be your pharmacist today. Were you picking this medication up for yourself or for someone else?
Oh, for my son, Michael.
For your son, all right. And I did notice there was a new prescription for him. Would you have about 5 minutes for me to discuss some important safety information?
Sure, yeah.
Fantastic, all right. Now, before I begin, I just wanted to verify the information I have on file. Is this the correct date of birth, phone number, and address for you?
Yes, all that is correct.
Fantastic. And is your son Michael taking any other medications, anything over the counter, supplements, anything like that?
No, nothing else.
All right, great. All right, so the medication I have for him today, it's called amphetamine, also known as Avecchio 5 milligram oral disintegrating tablet.
Okay.
What does your doctor say, or his doctor say this medication would be used for?
To help with his ADHD.
Right, and so is he having trouble, focusing or difficulty in school, anything like that?
Yeah, he's been in a management program where he goes to therapy and he learns coping skills, but just lately it's not been enough. So we made the decision he needed to have some medication, some more support, I guess.
Right, absolutely. And this is definitely a medication that can help in that area. It'll help increase his attention and focus and hopefully allow him to do well in his other programs. And so how did his doctor say the medication should be taken?
We talked about it, but there was so much going on at that meet that I just don't remember.
Not a problem. That's totally why I'm here. And so when using this medication, it'll come in a blister pack. And so make sure to use clean hands. It's an oral disintegrating tablet. So it's a little bit different from how we typically take medications. So when you give it to him, tell him to just place it on his tongue and let it melt. So kind of like a hard candy or something, just leave it there, let it melt. Don't swallow it, don't chew it or anything like that.
Okay.
All right. It doesn't need to be taken with water, just let it dissolve.
Okay.
All right. Now, how did the doctor say he might react while on the medication?
You just said that mostly it was going to help with his focus.
Right, so that's the main thing we're targeting, increasing that focus and attention. But some of the common side effects he might experience, if you notice some decreased appetite, it also can keep him up at night. And so it's best to take it or have him take it before 12. And I'd say that's pushing it already.
Okay.
So take it early in the morning when he wakes up is best.
Okay.
All right. And this medication, if you start to notice some signs of headache or he has changes in mood, at that point, it's important to call the doctor right away.
Okay.
All right. Are you doing okay so far? I know it's a lot of information.
Yeah, okay, so far. Yeah, thank you.
Yeah, of course. And so this medication doesn't have any refills on it just due to the nature of it. So once he's starting to get low, go ahead and give your doctor a call.
Mm-hmm.
He'll be able to set up an appointment, see how Michael's doing on the medication, and determine if it's something that should be continued.
Okay.
All right.
Okay.
If he misses a dose, again, take it before 12, but if it's after 12, you can go ahead and just skip it and take it the next day. You don't want to take 2 doses at the same time.
Okay. Okay.
And then keep it in a cool, dry place away from sunlight and humidity.
Okay.
All right. And I know I've covered a lot of information today. Would you mind repeating back to me the steps of how Michael will be taking the medication?
Sure. He'll take it in the morning, just once for the first 7 days. And then after that, he'll take it like when he wakes up and then before noon, and with clean hands. And it just sits in the mouth and then it will dissolve.
Right. So 1 tablet by mouth for the first week. And then after that, he'll be increasing it to 2 a day. And again, just let it sit in the mouth to dissolve. And again, watch out for the changes in mood or anything like that. If you see that, call the doctor right away. And again, best before 12.
Okay. Okay.
All right. Did you have any other questions for me today?
I can't think of any.
I know it's a lot of information to take in, especially early on with this medication, but if you do have any questions, my name and number is right on the label, so give me a call at any time. We're happy to help.
Great. Thank you so much.
Absolutely. I hope you have a wonderful day and that Michael does really well on it.
Oh, thank you.
The APHA Academy of Student Pharmacists, with over 36,000 members from the 142 schools and colleges of pharmacy nationwide, is a subdivision of the American Pharmacists Association, the National Professional Society of Pharmacists.